Welcome to Aging Untold. A dementia diagnosis can be overwhelming because the questions start immediately. What happens next? What's normal? And what can be done right now? Today, we're focusing on guidance for both the person diagnosed and the caregiver. Dr. Ray, what should patients and caregivers do first, medically, and who should be on that care team?
Well, I think hopefully you know what you were looking for in terms of making a diagnosis. You came in with symptoms or concerns. So the first thing I would, number one, want is hopefully you brought somebody with you, another set of ears, all right? Mm-hmm. And then once this discussion takes place and you say you have dementia or so, it's not the end of the story. It's really, it signals the beginning of a plan, mm-hmm. all right? And that's why you need the other ears around you. So we're going to all hear different things to put this plan together. Mm-hmm. You want to establish clarity first. So clarity is what type? You know, is this Alzheimer's? Is this vascular? Is it Lewy body? Mm-hmm. Is it frontal temporal? They all have different ways of management, and they're gonna go down a different road. Mm-hmm. So you want to recognize that. But you want to make sure that you're looking out for reversible things first. Mm-hmm. Okay, so different things like vitamin deficiencies or hypothyroid, anything that's metabolic that can be reversed, you want to identify that first. Mm-hmm. And then you want to build your team. So what is this team going to look like? It's going to look like your primary care doctor, maybe your geriatrics doctor, neurologist, physical therapy, occupational therapy, even a nutritionist, because a lot of the different things that control inflammation and neuroinflammation comes from nutrition. And the other thing I would do is get cognitive baseline testing, because I want to see where I am right now and where I'm going to
Very
go.
good.
Those would be some of the first things I would start with.
I also think a dementia care educator is so valuable for the family to help advise the family, prepare the family, and be there as a resource and an advocate along the way.
I think the minute you start looking around in your community, you'll find there's support groups for all types of dementia. I would go there. There's good books on dementia. I would get those books. There's professions out there, dementia educator one, gerontologist is another, aging life care management is another. So you can pull from resources. There's a lot of community talks. Mm-hmm. And lots of people are doing community talks. Go and then start gathering information to see who else needs to be on your team, and then look at the money. This is a potentially very expensive diagnosis, and so look at your money and look at the potential trajectory of the diagnosis. Now, some people say, "How long is this going to last?" And you can quote statistics. You can say, "Oh, average expectancy is 8 years." But what I like to look at is just get educated on the stages: mild, moderate, severe, and don't try to set a date, because that adds pressure and stress.
Yeah. So I'm going to say the first thing, because I've sat in the room with a loved one and gotten this diagnosis, and the very first thing you do, breathe. Literally just breathe. And you have to realize that a progressive dementia, now there are some that are treatable. A diagnosis of dementia doesn't mean that I have a progressive, but let's just say we have the progressive dementia that's a disease progression. Mm-hmm. So you have to realize that this is not a cliff that you're going to fall off of. Yeah. They call Alzheimer's the long goodbye for a reason. Yeah. And it's because there is a very long length of time depending on how early we diagnosed. Mm-hmm. And so don't get so hyped up in the fact that there's been this diagnosis that everything has to change immediately. Mm-hmm. Right. Talk, plan, build memories. And, that was our decision, was we're going to make memories while we can. Mm-hmm. And, she may not remember, but grandchildren will, loved ones will, the other people in your life will remember that time and do those things early on. Okay, we all have a bucket list. Go work on it. A lot of us have these things I would love to do. Work on it. Mm-hmm. Don't stop living because a diagnosis came into your life. Educate yourself. Our home's fortunate. That is my field of study, is cognitive impairments. And so educate yourself and learn. Our diagnosis came very early because of my education. But if you're in a stage where maybe you're past that mild because there is some hiding, then learn all you can. Find a support system, absolutely. And realize that everything you hear isn't what everyone goes through.
Right.
You've said it, it's true. You see one person with dementia, you've seen one person.
Yeah.
Because it presents differently for every single person.
And don't hesitate to get a second opinion.
Yeah.
Second opinions are very, very valuable. And you'd be really surprised to see how many helpful foundations and organizations there are for every type of dementia.